So actually then going back to what you said very early on, that yes, we all think, oh, vitamin C, yes, we know that's important, but as you said, for many cases, we're really not, we're just taking the bare minimum to prevent what we come to know of, or we talk about as scurvy. But what then really do you think would be the optimal amount that people should be looking at with vitamin C?
Well, what I have had demonstrated to me, to my satisfaction, over and over and over through the years since first encountering Dr. Huggins and seeing the different things that went on there, is that, and this is a tough pill to swallow, if you will, for a lot of people, but please don't kill the messenger. I'm just trying to tell you what it is, as they say. And that is that, for example, root canals put out around the clock so much toxicity that there's not a supplement regimen that I can think of that's going to compensate for that toxicity. Does that mean it's of no value? No. I mean, you'll still lessen the impact of whatever toxins are present by taking good quality antioxidant supplementation, but you're never going to get yourself into the plus column. And you're never going to stop, in my opinion, the atherosclerotic effect of the toxins as long as root canals are present. They're just internal, nonstop factories of the most potent toxins known to man. And I know it upsets a lot of dentists out there, but I'm not approaching this from a political point of view. I'm approaching it from the fact that a root canal is what we call a fatally flawed procedure. You go to the dentist, you have pain in a tooth or something else, and they say, well, let's root canal that tooth and it won't hurt you anymore. Well, that may be good just from the point of view of pain, but what do you do when you knock off the top of the tooth and you core out the nerve and the blood supply? Well, you may get a lessening or elimination of pain if that was the problem, because you cut all these nerves. But what did you also do? Well, this pulp inside there is like the Grand Canyon to a virus or bacterium. And in the course of the tooth initially being infected and painful, it's impossible to sterilize that tooth. So it's well documented again by Dr. Weston Price and others that these bacteria and virus get into the miles of dentin tubules that are present inside the tooth. And when you took out the nerve and blood supply, guess what? You took out the ability of a healthy immune system to get out into the dentin tubules and everywhere else that you go. So the immune system is not magic. They're real cells, real physical entities that literally need the appropriate lattice work and delivery system to get out to the areas where the bacteria and virus are. So because of this is why I use the term a root canal as a fatally flawed procedure. When you say 100% biological science, people think, well, nothing's 100%. Let me just say this. In a series of over 5,000 consecutive extracted root canal teeth that were analyzed biochemically and toxicologically, 100% of them had exquisitely potent toxins in it.
Wow.
So does that maybe mean that somewhere out there you might find one root canal that's not highly toxic? Maybe, but it's going to be less than 1/100th or 1,000th or 1/10,000th of a percentage. So I don't think that's an odd anybody wants to take.
In your book, Stop America's #1 Killer, one of the three major things that you recommended is that people actually have these root canal teeth removed.
Absolutely, and I got to give Dr. Huggins credit for, I thought, one of his best one-liners I've ever heard him make regarding this situation is when you try to start taking a lot of quality supplementation while the toxins are still coming in from the mouth and elsewhere, it's like trying to dry off while you're still in the shower.
Yes,
okay?
Very good.
You got to stop the inflow and then start compensating and building up the immune system and getting the all so critical antioxidant levels up to normal